Okay, so it is 11. Just wanted to welcome everyone to our webinar. We will get started. It looks like we have a couple more people joining us, but in the interest of getting to the rich discussion, I'll start us off. So yeah, welcome again to this webinar, Monitoring and Evaluation for Global Female Genital Cutting Programming. My name is Leah McCarroll, and I work here with Canadian Partnership for Women and Children's Health, or CanWatch, as a Senior Knowledge Exchange Officer. So we are based across Canada. So we're thrilled to have so many of you join us today. We're hoping this will be a very interactive discussion. And we've brought together a group of panelists from various organizations to bring diverse insights on monitoring and evaluation strategies used by international partners to end FGC by 2030. So just a couple of logistical notes first. If you've never used Zoom before, if you'd like a little refresher, we do encourage you to turn on your webcam and microphone if you are able, just so you'll be able to participate more actively in the discussion. But if not, if you don't have that technological capacity, no worries at all. We can still definitely, and we do welcome your input. So you'll also see that there is a chat box at the bottom of the screen. So you're welcome to share insights or questions as we go along today. And you can also find the mute and unmute button at the bottom left-hand side of your screen. So when you'd like to ask a question or participate in the discussion, then you just have to unmute yourself so that we can hear you. So yeah, welcome again, everyone. And with that, I'll just turn it over to Miranda Dobson. She is the Communications Manager with Orchid Project in the UK, and she's going to set the stage for the discussion today.
Thank you so much, Leah, for the introduction. I'm delighted to be part of this space with you all again today. So to give a summary of the first webinar that we jointly hosted in May, this session focused on the basics around female genital cutting, the work that Orchid Project and AMREF do respectively, and we heard from representatives working across this issue, including voices from the grassroots and from a research perspective. My colleague, the Programmes Officer from Orchid Project, Jenna Richards, gave an overview about what FGC is as an issue, including the different types of FGC that are practiced and where it happens in at least 45 countries around the world in Africa, Asia, Middle East, and within the global diaspora. We also talked about the ways in which the practice can impact girls and women physically and psychologically throughout their lives, and discuss the primary reasons that communities practice FGC, including cultural beliefs, the misconception that FGC is religiously mandated or to preserve virginity, or beliefs around hygiene and cleanliness. We also discussed FGC as a social norm held in place by the whole community, and which makes it difficult for one person or one family to abandon the practice alone. Orchid Project has seen that the most effective method of empowering communities to abandon the practice is through holistic, human rights-led approaches using non-judgmental open dialogue. We also talked about UNICEF's effective framework, the 6 elements of abandonment, which I will post a link to in the chat after I finish speaking. And we also looked at efforts from international actors to end the practice, including Canadian efforts specifically towards ending FGC. And we heard a little bit about Orchid Project and our grassroots partners from around the world, which includes TOSAN in West Africa, FAITH, the Coalition on Violence Against Women, and the Education Centre for the Advancement of Women in Kenya, and our partner in India, SEO. We were joined by SEO's co-founder, Arifat Johari, who spoke about how FGC is practiced within the Dawoodi Bohra community in India, Pakistan, and the global diaspora, and the non-judgmental approach that they take in discussing FGC within their setting, as well as an overview of initial research that they've carried out. Arifat talked about some of SEO's communications, advocacy and storytelling activities, and she shared resources for the public and activists working to end FGC. We also heard from Peter Ngura, Interim Director for the Anti-FGMC Centre of Excellence for AMREF Health Africa. He discussed how AMREF works with communities in Kenya and Tanzania to abandon FGC, and how communities are supported to transition to an alternative rite of passage through community-driven approaches. Peter also talked about lessons learned through their work, and all of this you can access by watching the recorded webinar through a link that I'm sure that CanWatch can provide. We also heard from Dr. Alyssa Koski, Assistant Professor and Epidemiologist from McGill University, who is on our esteemed panel today. Alyssa gave a really interesting insight into monitoring and evaluation in FGC programming, including a brief overview of what has happened to date and the most common ways of monitoring and evaluating attitudes around FGC. We also discuss limitations of M&E, of FGC programming, ethics, and what the gold standard for M&E is in this context, which brings us nicely onto the focus for today's discussion, where we're going to dig a little bit deeper into M&E with our panel. So I'm glad to hand back over to Leah. Thank you.
Great, thanks so much, Miranda. So as Miranda mentioned, today is more of a panel discussion followed by some group discussions. So we have a number of panelists here to share their insights. So to start us off, we have Jessica Fern. She is my colleague at CanWatch, and she's the manager of Global Health Impact. And then we have Alyssa Koski, who Miranda also mentioned. She's an assistant professor and researcher at McGill University. We're also joined by Kevin O'Neill, who's the director of programs from AMREF Health Africa in Canada. We have Clodagh McCarthy, who's the senior programs manager with Orchid Project. And then we also have Machaya, who is the programs officer for YWCA in Kenya. So just for some context, YWCA are an implementing partner of Orchid Project on their Positive Choices program in Korea, West Kenya, as well as on a forthcoming baseline study into FGC, which is carried out in partnership with Orchid Project's Kenyan grassroots partners. So that's just a little bit of background on our panelists, and you'll get a chance to ask them some questions and hear from their experiences. So I'll pass it back to Miranda.
Thanks so much, Leah. Yeah, so let's dive into our panel discussion. So my first question is to Jessica at CanWatch. Jessica, I was wondering if you could tell us a little bit about why is this a critical moment for us to be talking about FGC and deepening our knowledge about it?
Absolutely. Well, thank you so much. And welcome, everybody. I'm really excited that we're building on this, and in particular, focusing on monitoring and evaluation, which is my area of interest and focus here at CanWatch. So one of the reasons that I think that this is a particularly important moment for us as for those that are Canadian actors or development actors or partnering with Canadian organizations is that there really is an opening right now with our current government's explicit interest in feminist approach to international development, and in particular the call out of sexual and reproductive health and rights and sexual and gender-based violence. Earlier this year, on the 6th of February, the International Day of Zero Tolerance against FGCM, our Minister Bibeau made an announcement of about $3 million towards FGC when she was in Benin, and really called out the importance of addressing this issue for the government of Canada. And right around that same time, CanWatch was very fortunate to be collaborating with Global Affairs to do what was called ground truthing of indicators related to sexual and reproductive health and rights. And if you'll bear with me, I'd like to very quickly, because I think sometimes it's easier to see something, I'd like to put something up and show it to you relating to the indicators. But we had a chance to connect with about 61 different organizations across Canada and globally who are leaders in SRHR, and we asked them, what do you think about these indicators? Are they useful? Are they effective? And here is what they told us. So one of the things that we heard was that so most of the indicators related to FGC related to under the category of sexual and gender-based violence. And what we heard from respondents was that there seemed to be people were glad that it was there, but generally they felt that the indicators that were there were difficult to collect. And although they were a good starting point, it would be very challenging for Canadian organizations to have the skills necessary to collect that data. FGC was actually called out specifically by many respondents as being a gap area. And we also heard that there was a real lack of confidence from Canadian organizations on how to collect gender disaggregated data in a lot of these cases. So in particular, these were the three indicators, and you can find them. I'll post a link to the detailed report in the chat, that in some way related to violence, and FGM was considered to be part of this. And as you can see, although people generally felt were acceptable indicators, they were concerned about their ability to actually effectively capture this information. So I think one of the key reasons that this is so important is that we've made these important steps. The government has said very clearly that it's a priority, and yet we are still lacking the really clear, detailed indicators that we need to be effective in achieving that goal. So I think, hopefully through these kinds of conversations, learning from the experts that we have here, we can start to be much more effective and make it so that this is not just the work of those specialist organizations, but really something that is mainstreamed clearly and deeply into the SRHR work that we do.
Thanks so much, Jessica. That's really interesting, especially to see that that's a specific concern of your members and Canadian civil society, that there is that gap in knowledge around indicators on FGC programming. So I'm glad that we're having this conversation. So our next question is to Dr. Alyssa Koski from McGill University. Alyssa, could you tell us a little bit about what some of the practical measures of FGC are that we see in the literature? And what are some of the practical ethical considerations when asking questions around FGC actually in communities?
Sure. Thank you, Miranda. I think one of the first points I'd like to make is that generally when we're talking about the literature, we're talking about the research literature, right? And most organizations want to know how effective their programs are at achieving their goals. That's the whole purpose of monitoring and evaluation. And if you're asking that kind of question, what effect is my program having on female genital cutting in the community that I'm working in, you're actually doing research on female genital cutting. So I think it's important to realize that these two streams of work, groups that are running programs focused on FGC and those of us who are more in the realm of research, are actually headed in the same direction in many cases, and that we're not necessarily separate groups, and there's a huge amount that we can learn from each other. And of course, one of the first questions asked when developing plans for monitoring and evaluation is usually, what types of indicators should we use to measure the impact of our programs? For most groups, the ultimate aim is to bring an end to female genital cutting. And so the ideal outcome, if that is your aim, would be to measure the prevalence of female genital cutting in the community that you're working in. And by prevalence, I mean how many girls or women are cut in the community, and has the program that you're running led to a reduction in that number? So practically speaking, if this is the type of indicator that you're interested in looking at, which is really the gold standard, I mean, the UN Sustainable Development Goals call for a reduction in the proportion of the girls in a certain age range who've been cut. This means that you'll ask questions of the form, have you been cut, or have your daughters been cut? The second main type of indicator that we see in research literature is measures of attitudes toward female genital cutting. So these types of measures aim to determine whether support for the practice is changing as a result of a program, or just generally over time as a result of social change. And so questions that aim to measure attitudes might include whether someone thinks female genital cutting should continue, or whether they intend to have their daughters cut. And I think it's very important to point out that there are serious limitations to these kinds of measures on attitudes. First and foremost, attitudes don't always translate into behaviors. So even if you see a change in attitudes, decisions about FGC are rarely made by a single person. So an individual's support or lack thereof for the practice may not actually mean that their daughters or women in their family are not going to undergo the practice. So that's one thing to think about. I mean, if it's possible to measure prevalence, that's really more desirable in most cases. The second limitation of these measures around attitudes or support for female genital cutting is that they're very subject to change depending on who's asking the question. So people are very likely to report what they think the person asking the question wants to hear, especially if the person asking the question is associated with a program that aims to end FGC. So, for example, if I remained in support of the practice, but I knew that the person who was asking me was hoping that I would say that I didn't support the practice, I might just tell them what they want to hear. So in general, we have a little less faith, I would say, in the research community and how strong of conclusions we can draw as a result of these types of measures of attitudes. And Miranda, you also asked, what are some of the practical and ethical considerations when you're asking questions about this in communities? And there are a couple of things that I think are important to point out. First of all, is that female genital cutting is a punishable crime in most countries in which it's practiced. So if you're asking a question about this and asking whether or not, say, a person has had their daughter cut, you may be asking them to admit to what is a punishable offense. And so you need to be cautious about the security implications of those types of questions. The second is it's important to ensure confidentiality. So as I mentioned, decisions regarding whether to pursue FGC for a young girl are rarely left in the hands of one person. So reporting opposition to the practice may have consequences for the person who's saying their opinion in social contexts in which it's highly supported. For example, 68% of girls who were cut in Mali had mothers who reported that they opposed the practice. So getting someone's true opinion could be difficult without ensuring confidentiality and making them feel like they're in a safe space to be able to report their true attitudes about it. I would also lastly note that language is important in this realm. It's important to use local terminology for the practice, and that varies to a large degree. I'll note that, Orchid Project, I've read on the website, specifically uses the term female genital cutting, which is also most common in the research community. And that's because the term mutilation is quite value-laden and can be interpreted as offensive in many groups. I think I'll stop there, but I'll certainly be part of the breakout groups should anyone have any further questions specific to research on the issue.
Thank you so much, Alyssa. Really valuable contribution. Really appreciate all your thoughts. My next question is over to Kevin from AmRef Health Africa, based in Canada. Kevin, could you tell us a little bit about what some of the challenges associated with M&E in the context of FGC are, and what are some of the issues that folks should take into consideration when they are evaluating FGC projects?
Sure, thanks, Miranda. As we know, changes in attitudes and changes in behavior are difficult to measure. In both cases, the accuracy and the reliability of the information that one receives can vary widely. This is true in general for measuring changes in attitudes and in behavior, but also especially true in the context of FGMC due to the sensitive nature of the topic. In each cultural context, formative research is needed and can be very valuable at the onset of an intervention, not only to gain a nuanced understanding of why FGMC is practiced, but in order to determine what will be the most reliable method of measuring changes in knowledge, attitudes, and practices around FGMC and measuring changes in prevalence. So we know that FGMC is complex and it's influenced by social factors, cultural factors, economic, political, and on and on. So while generating data on change and prevalence of FGC is one challenge, another even bigger challenge is measuring the impact of a specific intervention. It is very difficult to demonstrate the causal relationship between a change in FGC prevalence and a specific intervention. Where a randomized control trial might be an approach of choice to generate evidence for some interventions, in looking at FGC interventions, there are a number of challenges that we need to take into consideration. It is difficult to find communities that are comparable to the intervention areas that don't have any spillover effect or are not influenced by any other intervention. Then, of course, there are the ethical concerns around raising expectations in a control group community without doing any intervention there. And as well, changing behavior around FGMC is a long-term effort, maybe longer than most institutional funding cycles. And then the cost for doing such an impact study is very high. So these might be some of the reasons that until recently we have not found a lot in the existing literature in terms of evidence-based interventions to decrease FGMC. That said, there is more research underway now than ever before to evaluate impact around FGMC, including the work that MREF is doing through our anti-FGMC Center of Excellence, the work of my fellow panelists. Also, there's the Evidence to End FGMC Research Consortium, led by Population Council, that is producing some really valuable research tools and information. And I can share a link in the chat later.
Great, thank you so much, Kevin. I'd like to take the conversation over to my colleague Macharia, who is in Kenya and joining us this evening from his perspective, this morning from Canadian perspective. Macharia, I was wondering if you could tell us about an effective methodology that you've used in a specific project and why that methodology is important.
Okay, thank you, Miranda, and thank you everyone for having me today. Basically, there are a number of methodologies that can be used, and one I would love to share is the recent survey that we did with ORCID Kenya and the partners here in Kenya. Basically, I would like to also allude to what Dr. Alisa has said, what are some of the indicators that projects also go through or try to find out. And in this particular survey, there were 5 thematic indicators that I strived to look at. And one was on the community information. One thing that the researchers tried to find out is what is the reason that these communities are actually practicing FGM or FGC in the respective communities. And it also tried to find out from within these particular communities, what are the attitudes that also attach to these practices that have been doing for the longest time. The other one is on prevalence in the family. And in this particular area, we were trying to find out what does the family hold in terms of cutting girls? Who decides where to take these girls, or who decides if these girls are supposed to go for the cut? And eventually, how many daughters have been cut in this particular family? The other thematic area was on knowledge, and basically on this, we were trying to find out from the communities on the rights they know that is related towards violence of the girl. In Kenya, we have a law, so we also wanted to find out, is there any knowledge from these communities on the law that exists and what it talks about, and what is the age at which girls go for this cut. The other thing was on the intentions. So basically, this goes to the parents and the guardians who are taking care of these girls. So we wanted to find out from these particular communities what are their intentions, or basically what do they prefer? Do they prefer girls who are cut? And even for their sons, do they prefer their sons to marry girls who are either cut or uncut? And then the fourth one was on abandonment. Basically, we were trying to find out from the communities, do they have any knowledge and information based on abandonment of FGC in their communities, our surrounding communities? Do they have any role to play in making sure that FGC actually ends? And finally, we looked at what the role of schools and teachers, because we know that these girls go to schools and so on. And we also know that there's also a high rate of literacy levels. So we wanted to find out from these schools and teachers, do they have a role to play? So we actually interviewed the teachers and this particular school. So to finally finish, we realized one thing: it is always important that we also upgrade this particular survey with ICT. So there was the link of using ICT, and there was no use of getting research answers through papers. It was purely on using smartphones, and we could also upgrade upload or rather the information or the results to our website in UK, and they could easily analyze. Thank you.
Thank you so much, Macharia. And I know obviously we're working in partnership on that particular project in Kenya to gather information about attitudes towards FGC. And I understand that a really important part of the methodology of collecting that data in an ethical and erudite way was to train community researchers on data collection so that it was peer-to-peer collected research. Yeah. I was wondering if you could say a little bit about how civil society can encourage local peer-to-peer gathering, data gathering techniques.
Okay, and I think picking from what you've said, the survey used a lot of peer-to-peer approach and community approaches, because we know for a survey to be conclusive, we must have a buy-in of the community and they have to own it. And to answer that question, I think the first thing is to help capacity build community facilitators to be able to collect this data, because it's very important because they come from these communities. So I think one of the areas is for trainings to be conducted to these community facilitators in order to be able to know how to collect this data from their own community members. The other thing I think is identifying resources, both financial and non-financial. I think you have heard from Kevin, I think one of the key limitations and challenges is it costs a lot to conduct some of these surveys. So, and I think if you are to make informed decisions towards designing and implementing programs that have community ownership, we have to find resources. The other thing is to encourage opportunities for learning best practices. Some of these communities that catch FGC, they don't live in isolation. They live in some communities that they don't practice the cut. Like the project in Western Kenya, the Kuria community do cut, but the immediate neighbors, who are the Luos, they don't cut. So I think it's also important that you encourage opportunities for these communities to learn practices. And then finally, it's also to maybe support and empower communities to look at other socioeconomic empowerment. This cutting sometimes is always attached to making livelihood. And some of these cutters, you know, they earn a lot of money. And in Kuria community, for example, the clan of elders normally collect a lot of money towards bringing these girls and boys to go for the cut. So if we empower the communities to source for other socioeconomic empowerment livelihoods, it's going to be very important.
Thank you so much, Macharia. It's really valuable input. Thank you so much for joining us. So that brings us to the end of our panel discussion. So I will hand back over to Leah.
Great. Thanks so much, Miranda, for leading us through that discussion. And thank you so much to our panelists as well. There will be more opportunities to interact with the panelists, as I'm sure there are lots of questions and people are probably looking for more information. So we do have a few minutes now to open up the floor for any questions or comments before we break out into smaller groups. So if you do have a question, you can either ask it using your microphone or post it in the chat screen and I'll share it with the group. So over to you. Oh, I see we do have a question here, and I'll read it out. So the question is, given the challenges associated with FGM, how confident are you that the results are reliable? So I'm not sure if that question is directed to a specific panelist, but if you do have a response, feel free to share.
Okay, I can based on the experience that we did with the survey. First of all, our community researchers were identified from the communities. We did that. We had a set criteria of who are the right people. And first of all, getting a researcher with the right credentials is very important. One, there was the issue of language, that he can communicate in the community language. Two, that person has to be non-judgmental, so that whatever information they get from the community is actually reliable. So we had a set of criteria. And one of the critical roles is, apart from being knowledgeable, he must come from the community so that they can be able to identify with this person. When he's asking those very ethical or critical questions, they are actually identifying with this person. He's from our community.
Great, thanks, Macharia. So we have another question here from the chat. It's from Mary Thompson. Are you aware of research that has gone on in Mali, and can you share that information, please?
Maybe I can respond to that briefly. I mentioned a statistic from Mali. There have been large national level surveys that measure the prevalence of female genital cutting over time at a national level in Mali, and also attitudes around it, whether or not people support it, both men and women, whether or not they believe it's a religious requirement. So those are available. I can share perhaps with Leah a link to a report on the most recent survey, and she can make sure that that gets around.
Great, thanks, Alyssa. And I'll take one more question, and then we'll have more ample time in our discussion groups to discuss. And again, the panelists can respond to the questions as we'll have these after the end of the webinar as well. So we have a question here. To transform behaviors, one of the strategies that is widely used in community is behavior modification, value clarification, and attitudinal transformation, or VCAT. Is there any evidence of this theory approach being used for FGM? And if yes, how can we measure it, since attitudinal transformation is difficult to measure and can take years? Any insights on that from the panelists? Okay, well, maybe we'll hold that question for after the panel discussion as well, because it might require a few more minutes to unpack. And I see there are more questions coming in, so I'll make sure to save those and share them back with our panelists. But again, you can discuss them in your breakout groups. So now we'll move into that portion of our webinar, which is breaking out into small breakout groups to discuss amongst ourselves and answer a number of questions. So I will break you into groups behind the scenes and just ask that you follow the instructions on your screen. The software will automatically place you in your group. And then I'll call everyone back into the main screen after our 10 minutes or so of discussion. And I would encourage you to answer the following questions when you're broken out into your groups. So firstly, introduce yourselves, and then we ask that you discuss your overall reactions to the panelists' insights, discuss a key takeaway that you could apply to your own work, whether it's explicitly related to FGC or not. And then again, if you find you've answered all the questions and you still have more questions for the panelists, then feel free to brainstorm some additional questions when we come back to the broader group. So with that, I will break us out into groups. And just a note that if you are calling in by phone, or if you find you're not able to contribute with your microphone, you can just use the chat box and contribute that way. So just stand by and I will break everyone into small groups, and I'll post the questions as well so you have them for reference.
The questions are there in the chat.
Oh, perfect. So maybe for the group that's still here, if you're having technical difficulties, I can help break you out here. So I see we have Mary and Anne-Marie.
Oh, I'm fine. I was just gonna wait until.
Oh, sure, no problem.
Yeah, thank you.
Absolutely.
Yeah, thanks.
Hi, Leah. Can you hear me? Yeah, so we have Jennifer here and somebody else, but neither of them have microphones. So we're not, I mean, I've asked if they have any questions. I didn't see any in the chat, but I don't know if they're just don't have questions or what, but I don't think we can do this for 15 minutes. You're on mute, I can't hear you.
Oh, no problem. So Jessica, maybe, oh, I see a chat from Jennifer.
Frontline officers who may encounter girls at risk. Great question. Great question. I think I'd actually really like to hear from Peter on that. He'd have some great thoughts, and also Kevin, because they do quite a bit with policy. In fact, would we be able to, given that, can you do that? Can you move Jennifer into a group with Peter or with Kevin?
Yep, I can do that for sure. So maybe I'll do that. And then Jessica, I can move you into a different group just so you can sit in and listen, unless you want to go back to the main waiting room.
I'll go into another group. That would be great. And Jennifer, please ask that question to Peter, given his experience. He'd probably be a great guy to ask.
Great, I will do some shuffling.
Thanks.
Hi, Jennifer. It's Leah back again. I'm just going to ask you to, in the little box it says leave breakout room. So I'll just ask you to click that, and then I'll put you into the group with Peter. For everyone here in this waiting room, I'll bring the full group back together in 2 minutes. So we'll just give a few more seconds for everyone to come back from their breakout groups. Great, so everyone's back on the main screen. Thank you so much all for humoring us as we tried something a little bit different to try and encourage some more participation and interaction. So now we have a few minutes just to hear some high-level reactions from your breakout group. So I just invite some volunteers to share some of your key takeaways or key takeaways that you heard or your reactions. We'd welcome to hear from you.
Hello. Can I go ahead?
Yeah, of course.
Okay. So Debbie and I, and Rabia and I were talking about a little bit about triangulating data from different sources in order to try to verify information which can sometimes be inconsistent, or it's difficult to know whether you're getting the real information. So we talked about triangulating data from a few sources, including the data that you get from people who are self-reporting, whether that is reporting on their attitude towards FGM or on actual prevalence. And we talked about how in some cases there are health facilities that might document cases of FGM. And so that's one place that we can look. But at the same time, we need to consider what is the utilization rate of services at health facilities, depending on the culture that you're looking at. And then finally, we talked about looking at school dropout rates as a proxy indicator. Again, depending on the cultural context and at what age and for what reason FGM is being practiced. And in some cases, some schools might even record the reported reason for dropping out. So that's something that we try to take a look at.
Great, thanks, Kevin. Oh, I just have a little message here. So from one of our attendees, men and boys have a huge role to play in FGM. It is critical that they be key participants in any sort of programming that seeks to end FGM. As such, it would be good to also measure some indicators of change within the male population. So that's a very valuable insight. Are there any other reactions or responses? And again, if you came up with any other questions for our panelists, I invite you to ask them now.
Okay, I can go ahead.
Oh, go ahead.
Oh, sorry. All right. I had Tiati and Marie in my group, and some of the interesting reaction was especially for Tiati, since she coordinates a lot of gender empowerment program. I think one of the key reaction was that the discussion actually met her expectation, and more so since they work with different chapters in Africa. I think she'll be more than willing to share with them, and for her to be able to learn more from these chapters on exactly what is happening on the grassroots. And also for Marie, they're hoping to start a new project in Benin. And from today's presentation, I think one of our key takeaway was to make sure that they also conduct a similar survey, like the one that was held in Kenya, to determine key thematic indicators, and which can also assist them a lot. I think there was a question about the boys, and it was also directed to me. And I think it's very important to say that in one of the key thematic areas, for example, on prevalence in FGC, we did ask a question to the boys and fathers, for example, what is their attitude and whom do they prefer, either their son to marry, and even for the boys, we asked them, do they prefer marrying a cat or a cat girl? So I think the analysis is going to be a little bit interesting because, as I said, for example, in the Korea community, they live near non-catching communities, and so we had a mixed information towards that. Thank you.
Great, thanks, Macharia. Other interventions or reactions?
So I was in a group with Mary, Ellen and Mary, and some of the things that we were discussing were the peer-to-peer data gathering that Macharia was outlining for the Kenyan baseline that he worked on with Orchid Project and with our other partners in Kenya. And something that Mary Ellen was interested in was how you mitigate the risk of, when it's peer-to-peer and community-led, about respondents knowing the people that they're responding to, and if there was a way that Macharia in the project you dealt with that. I was wondering if you could speak to that a little bit.
The researchers that we did identify, it does not necessarily mean they are known throughout the community. The community is very big. One key indicator or one key component we need to know how we mitigate is that if you go into a house and a family thinks they cannot be able to give you that information, we had paired our researchers so that they can be able to give to another researcher an opportunity to ask questions. And one key component also is that communities always identify with their own in terms of language. And they all know, for example, if it's an issue of FGC, they know it is rampant. And it also depends on how the researcher also asks the question, all right? Is it in a non-judgmental way? So we trained our community facilitators and the researchers on how to ask questions, how to handle ethical and non-ethical situations. Because in some cases, for example, we did find researchers walking into a family, they know the family, and then there's a tragedy that has just happened. And emotionally, they are attached to that particular tragedy. So the first thing is how we train them on how to go about it, that to stop and that kind of thing. The other challenges we got, for example, people asking for money, for example, because they know you are one of their own. They're like, oh, you've been funded to do this survey, so you must be having a lot of money, So we did train also our facilitators on how to handle and how to mitigate such. And I think, I'll try to answer that, yeah.
Wonderful, thank you. The floor is still open for any questions or comments.
Hi, this is Sophie. Can you hear me?
Yes.
Okay, great. I'm reporting back on behalf of our small group, which had also Kristen, Jen, and Homi in it. And we kind of talked about, I guess, the complexity of researching something like female genital cutting as opposed to other issues. So, if you're working in health, for example, you might be looking at disease or mortality-based data and so on, perhaps dealing with issues that are less sensitive on various levels. So we appreciated kind of looking at all the different indicators and the need to really draw from different indicators when you're dealing with something like FGC. Also, I mean, because it is something that's so complex and sensitive, you also need to really think about it in the long term. And Kristen mentioned that takeaway that she'd taken from the presentations was a need for really long-term sustainable funding, both to make a difference, but to be able also to measure the work that you're doing and so on. And finally, the last point, I guess, is also how do all these issues tie into gender equality markers? So how can FGC kind of tell us more about gender equality, and also how can gender equality markers be used in studying a specific issue like FGC? So those were some of the points that we raised. And I guess the last one would be a bit of a question to presenters. How do gender equality markers tie into all of these this research and these issues? Thank you.
Great, thanks, Sophie. I'll leave it up to the panelists if there are any responses to the gender markers question.
I would just say that for us, like for AMREF Health Africa, when we look at FGMC, we're never looking at it as a standalone topic, or when we're discussing it in communities, it's never looked at it really as a standalone topic. It's always integrated with issues of education and the need for to finish an education. It's tied in with teenage pregnancy and child early and forced marriage. And in the contexts where we work, FGM is wrapped into the rite of passage from girlhood to womanhood, and often more often than not, a girl who experiences FGM is then she's graduating to womanhood and then is eligible for marriage, which then leads to a school dropout, early pregnancy, and so on. So for us, FGMC is intrinsically linked to gender equality because it does cut short a girl's potential. So so we see the two as absolutely tied together.
Great, thanks, Kevin. And I'm just looking at the chat box here, and I noticed we had a question from Rabia. Do we have any record or data of FGM being practiced in developed countries or Canada? And in our first webinar, we did discuss that and the prevalence of that. So Rabia, I'd encourage you to take a look at that recording. And I know AMREF has been doing some work on that, so we can get you in touch with AMREF. And then we had another question from Jennifer, just for something to think about. She wrote, I'm a policy writer for a law enforcement agency in Canada and was wondering if they have any best practices for frontline police officers who may encounter girls at risk. So I think that's also a very important, from a law enforcement perspective, a very important one to consider. And again, if anyone has any insights on this, I'd encourage you to share now or connect after the call.
And if I may, sorry, Leah, just in the chat, I've posted a link to a resource page that CanWatch put back as we did our Metric Monthly Bulletin Spotlight on FGC and SGBV in May. And there's a link in there to a series that was done by the Toronto Star that looked both globally and within Canada on FGC. That may be of interest.
Great. Thanks, Jessica. So we are coming to the end of our call. So I just wanted to thank you again to all of the attendees and all of the panelists for joining us for this rich discussion. It's definitely not the end of the discussion. So on behalf of CanWatch, I do really want to thank Miranda at Orchid Project, Alyssa, Kevin, Macharia, and Jessica. These strategies will be instrumental in not only ending FGC by 2030, but in advancing important gender equality objectives as we discussed. So this recording will be made available online shortly for your reference and for sharing with your colleagues. And we do encourage you to stay connected with us on suggestions for future webinars or learning opportunities in the global health space. And I'd like to just hand it back to my colleague Jessica to let you know about a practical tool for further sharing.
Thank you, Leah. So one of the things that you'll see in the link that I shared is that CanWatch has a resource called our Project Explorer. It's an opportunity for us to capture the full scale and scope of Canada's investments in global health and gender equality. And one of the key areas that we can now do is actually search and compile information on projects about particular topics. So we can look at things like where the money comes from globally for these projects, where they're working, who the local partners are. It's a really fantastic tool for learning and for growth. I'll put in a slight plug, for example, for our colleagues here at AMREF, and we have the ability to quickly and easily search the projects that they have entered here on our database and also by topic. So if you are part of a organization that is doing work in FGM and FGC or other related topics, and you want to have that information available here, we would love for you to let us know. You can enter your projects directly or we can do it for you. That'll really help us have a compelling picture of the full scale and scope of what Canada is doing. So feel free to visit our website, go to our Project Explorer, or email me directly, and we will get you connected. So thank you so much for helping us to grow this picture and to be more effective in the data collection that we do.
Great. So again, I will save all of the questions in the chat and we will work with our panelists to try and get some responses or to connect you to some people who might have responses. And thanks again, everyone, and have a great rest of your day or evening. Bye.